So, sorry I'm a bit late. My name's Nico. I'm one of the people talking to you today. We've got a couple of other F1s who kindly agreed to share all their information and knowledge. I guess you're all finalists. I hope you've all had a good elective and enjoying your time back. It always makes me feel really young coming back and talking in university again with all you guys. So what we want to do today is give you a bit of information about your SJT exam, which I think is going to be in December time. It comes around quite quickly, and I remember sat sort of, well, being a final year at King's and not really knowing what the exam was about, where to go, or what to really do to try and work for it. I remember thinking I hadn't really done much medical ethics since like second year, and wasn't really sure what would come up. So I sort of tried to prepare as much as I could do, and that worked quite well for me and for a lot of other people. So what I want to try and do with this talk is not teach you, the basics of what the exam content is going to be or the curriculum and go through good medical practice, but really what you guys can be doing to get yourself in the best possible position to try and achieve as good a score as you can in an exam, which I'm just going to explain why it is a bit quite important. So particularly in my year, I'm not so sure if it still happens. A lot of people will be telling you that this is an exam that you can't really prepare for. It's something that you're either good at or you aren't doing, so there's not really much point in working towards it. But I think I disagree with that in the sense that even if you look at the FPAS website and all of that, it sort of phrases what you can do for the exam on there and says things like they expect you to be familiar with good medical practice. And that's essentially saying you need to be familiar with everything in there and treat that like a curriculum, and that's something that you've got to learn and be familiar with. So it's not like facts that you learn in a textbook, it's more concepts to be familiar with and have a good understanding about. And actually, I think looking back on F1 and my first year of medicine, actually you can get away with quite a small amount of actual book knowledge, and actually the knowledge and the skills you develop from understanding and developing these sort of personality traits and characteristics will actually hold you in much better stead from a clinical point of view. So rather than just focusing on this for an exam, it is something that you will find quite useful when you come to work in under a year. What this exam expects from you is quite difficult actually. So you've been students for the last 4 or 5 years and you're going to be for another year, but what you need to be for this exam is an F1. So someone who's working in a hospital, who's got responsibilities, who manages patients on a day-to-day basis. So that's the big step that you're going to have to take in August, and before that you're going to have to take before you sit this exam, because that's the shoes you're expected to be filling when you're answering these questions. So briefly, just to mention again how important this exam is, it counts for 50% of your grade or score when it comes to your ranking. So as I'm sure you're aware, you have to pick where you want to work, and for some people that's a really big decision, for some people they're less bothered about it. But I think there's no harm in being in as good a position as possible to make sure you get the jobs you want and work the places you want. Just to talk about the way that it's scored is that this is scored on a scale of 0 to 50. And there are some people who do so badly that they do score a 0, and that's not going to be the vast majority of you. And if that does happen, and you do so badly in this exam, it'll call your whole training into question, and then you'll be reviewed and not progress next year. So it is possible to do quite badly in this. But for the majority of you, you'll sit within this bell curve of scores here, and that tends to range from well, the mean score is around 38, and it looks like it goes down to around the mid-20s, and for the lucky people, I guess, or the really skillful people, it goes up to 50. And that does determine where you spend your next 2 years. And I mean, to give you an idea, when the scores all went wrong and they had to reshuffle just a couple of marks in 2013, that affected 20% of people's scores, which caused 148 people to have different jobs based upon it. So even small differences and doing a little bit better in this exam can make a big difference in where you work. Just to give you an idea, so, and I mean, whether it's a good thing or a bad thing, this single exam is worth as much as all your EPM, so all the exams you've done from that. So in terms of its weighting, the FPAS people put a lot of weight on it. So what I'm going to try and do with the help of my colleagues is talk you through the background and the structure of the SJT exam, because hopefully if you know what the exam is going to be like, you're more prepared for it, you'll be able to approach it much more confidently. Then share our experiences and tips. Over the last few years, I've sort of looked back and thought what worked well, what didn't, what things that we all did that did work well, and you might notice there are some things which you might feel we're repeating, and that's not because there's not much to say, but that's because those are the core things that really we've all felt separately did make a big difference in how we did. So do pay attention to that really. But obviously the caution to that is this is just our advice, and this is what worked for us. So do take that with a pinch of salt. And then we'll go through the different materials, the things that you could be using and things that you can be doing now over the next couple of months. So the exam is made up of 70 questions. 10 of those will be pilot questions, which means questions that they're using to gauge for the future years, so it won't count towards your score. So of the questions that do count, there'll be 60. 40 of them will be ones where you rank the top rank the 5 options in terms of most appropriate to least appropriate. And they have a net worth of 12 marks. So obviously if you get them all in the wrong order, you'll score an 8. And if you get them all in the correct order, you'll score a 20. The addendum to that is if you get them all completely wrong and you're putting very inappropriate things top, you can still score 0 in that. The other 20 questions will be ones where you have to pick the best 3 out of 8, so the best 3 options which are suitable out of 8, and again, they account for 240 of your marks. So the reason that I'm just talking about this is because there will be 70 questions, and in a lot of exams you've done till now, and a lot of practice questions you may have done, 70 questions isn't too much to fit into 2 hours and 20 minutes, and it does break down to around 2 minutes per question. But I think the one big piece of advice that I'd like to share from my own experience was that goes very fast. When I was doing these practice questions that you get in these books and things, I found that I was working through them quite quickly, not having any problem with time. And so, unfortunately, when I got into the exam, I was 10 minutes in and realised I'd only done 1 or 2 questions. And I think the difference there is, one, when the weight of these questions and the pressure of these questions is so much more, you find that you're taking a lot longer to scrutinise every word, which I guess is a good thing. And also because the questions in the actual exam are a lot harder than some of the practice questions you may have done, a lot more detailed, questions are a lot longer, and the answers are a lot more specific as well. So it does take a lot longer to work through the questions. So I think it's important to be aware of that time limit and to practice, and actually in the exam do stick to that timing quite tightly. And the reason that is important is because it does matter if you finish it there. If you just bear with the logic here. Like this is the same curve that we saw a few minutes ago of everyone's marks. And what you can see here is a lot of the marks are all scrunched together around the 35 to 45 mark. And the number of candidates who score 40, that represents around 1,000 people. You've got 8,000 final year students within this bell curve. And your score, and it'll be pretty similar to hundreds and hundreds of people. The SJT is scored to 2 decimal places, so a little tiny mark in a tiny difference in your score will push you 100, 200 places above someone else or below someone else. So the reason that's important is because if you miss out 1 question and you miss out on 20 marks, if you miss out on 40 marks, if you miss out just 2 questions at the end of the exam, that's equivalent of dropping 2 or 4 points in your FPAS score. So that'll take you straight from here to 2 marks there, 4 marks there. So it'll drop you 2,000 places, which is a big deal, really. And in terms of your final score, that's the same as the 2 TPSCs, missing out 1 question in this exam. So if you do try and stick to time and finish your paper, that will give you the best possible chance of trying to get all the marks as possible and not leaving any blank, because that will score you a 0. Obviously that means don't, in the last 5 minutes, rush through and guess them all, because they say there's an algorithm in the computer that marks your score, marks your papers, that will catch you if you're guessing, because you're putting completely inappropriate things in the wrong order, and that'll score you 0 as well. So try and pace yourself. I just want to briefly look at how the paper was designed. There was an expert panel that got together called the ISFP, Improving Selection to Foundation Program Panel, and that was made up of a lot of professors, a lot of consultants, a lot of senior people, actually 40 of whom were consulted and only 6 were F1s, and their job was to try and determine what an F1's duty is, because that's what they're going to try and examine you on. They performed 29 hours on the ward, so that's 2 or 3 days, and they came up with a 127-page document. And the reason that I'm highlighting this is that this means that the exam that you're sitting isn't designed by F1s. It isn't designed by what you think is important to an F1. It's designed, and the content of it is what a consultant, what a professor, what a senior person who hasn't done medicine on the wards for 10 years will think is important. So it's important to bear in mind when you're coming across a situation, that it's through the eyes of these examiners, not through the eyes of an F1. They came up with these 6 core duties that an F1 performs, and I think some of them are quite accurate, I suppose. But the reason that this is useful for you is that this is essentially the curriculum. This is what the people who are writing the questions in your exam feel is what an F1 does, and this is what they're going to test you on. So again, if you look at issues of confidentiality, hearing a colleague talking about a patient outside of work, although we'd all agree that's inappropriate, an F1 might say, oh, sometimes it happens, or not be as stringent and as strict on something like that as a professor or someone writing these exams would be. So it's important to bear in mind, when you're looking at these are the thoughts of an examiner who's a senior consultant or a professor, not an F1. This is all available on the website, on this website, and if you type this into Google, the F1 job analysis report, you can find all this and all this information. And it's essentially like a curriculum, and it's something which you can look at, something you can discuss with your colleagues, and essentially think about what you would do in each of these situations if you're looking for content to be working on. Okay, so sort of going back to that, one thing that I found quite difficult was when it came to the exam, and there was a question about negotiating a scan, about hearing your colleagues talking about something at work, I would go straight to what I've heard in that situation, or from my brief time in the wards in final year. Oh, I saw this happen this time, and this is what happened, or this is what I think I would do, this is what I think the best option is. But what you've got to again remember is this exam is written by quite senior doctors, looking at it through the eyes of and they're sort of deciding how the perfect F1 would behave. And that obviously isn't me, and it probably isn't most of us. So I think what the best way to approach these questions is from a very objective point of view. Rather than putting yourself in the picture of thinking, oh, what would I do if I heard my 2 friends that I'm sat next to now talking about a patient. I tended to picture an F1 that I was shadowing when I was a final student, called Dr. Duke, who was really, really good actually. Very robotic, very down the line, really textbook really, and it did everything sensibly. And so what I would do is when I came to a scenario like hearing 2 people talking, I wouldn't think of what I would do, I thought about what he would do. And I think that helped me approach things more objectively and sort of see it from the examiner's point of view rather than from my eyes. Something which I think the F1s will go into in a bit more detail is it's important to get stuck in on the wards. And although that's something you probably do hear a lot from the medical school itself, I think it's something which does make sense. You'll be doing this job within a year, and you'll be expected from day one to know what a ward round, what a grand round, what chasing a scan, what talking to the radiologist, what referring to a different specialty, what a cross-match group and save is. All these words have got to make sense to you, that they're part of your day-to-day vocabulary, because they will be when you're an F1. So when you're reading the questions in these exams, they'll be written as if you understand all these words, and that'll be taken for granted. And I think the only way you can really understand what a ward round is, what a grand round is, what a on-call shift means, is by doing it. I mean, you could probably read for weeks, but I think the easiest way to do it is by getting stuck in and seeing what actually happens. And so that is something which will be quite useful and will help you become more familiar with the curriculum, with everything that they're going to be testing you. Just hand over to
Hi, my name is Penny Louise. I'm one of the F1s, and I was also a GKT student, not long ago, sort of in a similar position to yourselves, wondering what this exam is all about. And what I think is the easiest way to approach the exam is, like Nikhil said, is knowing what it's assessing. And in terms of this exam, it's basically used as a tool to predict how you're going to, how well you'll act next year as an F1. So that's the easiest way to approach it. And to know what the roles of an F1 are, so like Nikhil said, the key attributes that they're looking for when they're selecting for the foundation programme. So things like commitment to professionalism, how you're going to cope with pressure, and how well you communicate with other members of the team, also with patients. How well you're focused on the patient and, you know, what they say, patient-centered consultations, and how well you can work within a team. Key to this exam as well is identifying common themes, because you'll read so many questions and you'll begin to pick up that there are common themes that runs between. So things like handing over your bleed, negotiating with radiographers for CT scans, etc. Patient confidentiality, breaking bad news. So you need to learn to pick up keywords in the questions, and that will help you when you're approaching similar questions to identify how well you want to structure your ABCDEs. So it's all about pattern recognition. But that being said, you have to remember that each question is new. Then no two questions are exactly the same. So while you have to be aware that there's themes, you still need to make sure you read the question properly, because otherwise you'll get caught out thinking it's the same question. You need to make sure that you don't just read the mark schemes and rehearse those. You have to make sure that you do read through them, and that each question you maintain a perspective as if you haven't seen it before, and just remember to think what you should do in that situation. So all the questions are based on situations that you're going to find yourself in as an F1, and some of them, once you'll start reading them, you'll think they're really silly questions, and I remember I did, but you do actually find yourself in these situations. So not just in terms of preparing for the SJT, it is a useful exam for next year when you're going to be an F1. So like Nikhil said, the best way to do it is spend time on the wards. You'll be very tempted to spend a lot of your time in the library reading, thinking, you know, you just need to pass your academic exams. But to be honest, those exams I wouldn't worry about so much. I think it's the SJT, it's 50% of your score, which counts for a lot. Most of you'll pass the academic exams, no problem. But in terms of the SJT, you want to not just be prepared for that, but for next year, you'll find it so much easier if you get stuck in, you shadow your F1, you see what their day-to-day job is, and you start to think like you are an F1. You're not a medical student anymore, you are an F1, you're going to be doing these jobs, you know, how are you going to go about it next year? And also, by being on the wards, you can start to observe how different staff members interact with each other, and again, these are themes that run throughout the examination, so that's useful. Trust your instincts. While they said it's an examination where you have to say what you should do, not what you would do, but in the same way, you're going to be able to identify, there's 5 options, what things you definitely would do and what you definitely wouldn't do, and that's how you start your ranking, and then the other things will fall between. And again, once you do several questions that are quite similar, you'll learn how to prioritise those answers as well. And yeah, the rest can just be ranked out based on your analysis then. But don't overanalyze the questions, because you'll find yourself spending so much time on one question that you won't get through the paper. So yeah, the key I think is practice. How I did it, we did group work, we went through questions, and then once you go through the answers, kind of discuss between you, your rationale for the answers. If you don't practice, you won't pass the exam. Some of the scenarios, like I said, are common sense, but some of them, they're just really tough. So just make sure you do as many questions as you can, so when you come to sit the exam, you are prepared. And again, because you will begin to pick up these common themes.
Okay, hi everyone, I'm Zara, I'm also ex-GKT F1. Okay, before I sort of go through the situational themes, I was just going to give my sort of piece of advice. So we keep talking about following around F1s, which is extremely useful, but like some of you, probably a third of you, I started last year on my GP rotation, where there aren't any F1s really to follow about. So that's why I think group work can be really important. Make sure that you are in a group with somebody who is following around in F1 and you can talk about it. Hopefully you will have seen F1s in your last 2 years if you've gone into hospital as well. So talking about the situational themes that kind of come up all the time. So safe prescribing, whistleblowing, a lot of things often to do in the questions, common things that come up about kind of consultants who may be drinking, smell of alcohol, colleagues who prescribe things wrong. So that's quite important, especially as an F1. Patient confidentiality. So DVLA, so sometimes you need to know a little bit kind of about the law. When is it okay to break patient confidentiality? So most of the stuff that comes up is seizures and insulin stuff. So make sure you know your stuff on that. You can often get that just from doing the practice questions themselves, but it's also useful to pick up as well. End of life decision making, what you can do as an F1 in terms of DNARs, what senior people need to sign it off, and what's the kind of status with the law in terms of relatives and what they're doing. So professional integrity, I think we mentioned before. Safeguarding children, vulnerable adults. Again, this is, I think it's really, really important as an F1. It's quite scary when you get somebody who's, who you think maybe should be safeguarded. So it's nice to have kind of like thought through all the options from the questions before. Criminal issues in the workplace is often things being stolen. There's sometimes as well kind of violent behaviour, patients who are a bit delirious. Not that that's necessarily criminal, but what you can, what you can't do in terms of force and sort of hold each other back. Breaking bad news, what can you say as an F1, what you need your regis, what you need your consultants to do. And work-life balance, when is it okay to go home, the patient, handing over safely. So these are all the sort of things that come up. And I've just got a few like a few questions which come from the SJT books, which I'm hoping you'll all look at. So just to have a look at the question and to identify kind of some keywords. I put the answers on the slides and they should be sent out to you. But you will have time to kind of work with them, chat with them, chat in groups, you know, with you when you're all kind of revising for it. So if I just let you have a quick look through, this is a really common thing that will come up for you next year. So mainly a radiologist will accept what you said for a scan. So I'll just let you read through that because it's quite long. And these are my highlighted words that I think are important. So just thinking through yourself in that situation, you often get consultants ask you to get scans all the time and you don't always catch what's happening. Remembering that it's an urgent one and that someone has rejected your request because you've asked for it wrong and what you should do. So those are my sort of keywords from it. You might have more keywords, you might have less keywords. And what you should do, and these are the answers. You can look at them in your own time, decide if you agree with them or not. I've agreed with most of the answers that I've put, that have been put up, but that might be because I used these questions before and have sort of just accepted them as answers. So the second one, I'm currently on a gastro ward, so this is another quite common situation I found myself in. It's also another one that I mentioned, so about violent behaviour. What are you and what aren't you allowed to do for patients? And so kind of keywords being, sorry. So you all might have like slightly different keywords to, like this is just the way my brain works for doing the exam. So obviously like so you need to know a little bit of background, so delirium tremens. It's night time, you haven't got very many staff around, so that's important about different things and different ways that you'll handle it. There might be less kind of senior help around, and the fact that some violence has occurred, but also the fact that it is a medical problem. He's not in his kind of own state of mind, and what you can do about it. And again, answers will be on the presentation that's sent out to you or when you're practicing. We haven't got too many more, so this one's a slightly shorter one to read. I'll give you another 30 seconds. Yeah, you can try and do answers as well if you want, shout them out. Okay, what are people's keywords? Do you want to shout out your keywords? Okay, so I'm going to move on to the next bit. So obviously important, it's a strong painkiller. So your work colleagues challenged it and they refused them to give it, so what are you going to do? So the answer is EC and H. I think this one's not too difficult. Okay, this is the last one. So again, have a look through it and try and answer it and talk amongst yourselves what you think keywords are.
Like we said with these ones, you can easily kind of identify what is the most appropriate and what's the least appropriate. It's the ones that fall between that you'll have the issues with ranking. So it's most important just to kind of rank based on what you see in other questions as well and the kind of patterns that come
Keywords is that it's asked you a question, you're an N1, and you should really be breaking it down about the or something. And you can look at the answers later, but I think I'm going to hand you over now to another one, the N1. About MSA SJT.
Hello everybody. Some of you might recognise me finally, there's so many of you. It's bigger and bigger each year. So I was at King's last year, so I remember being sat here amongst you last year. And I'm currently working at King's doing a surgical job, so if you're in the round last week, you can shout at me and ask me for advice if you like. So what I thought I'd talk to you about today is just whiz over a couple of just general tips for the SJT and also just for next year as an F1 on the wards. And then I'd like to just give you a bit of personal advice regarding what you can do now to prepare for the SJT and also a few bits for during it. Okay. And I'd like to apologise in advance if I am repeating some of the things already said, but it's just going to drive the message home when you're so that's okay. So first of all, just a few main things that you'll find throughout the SJT. So escalating problems is a common theme, so generally speak to that person directly first and then escalate up the ladder, and usually you'll speak to your senior on your team first before going to the senior, the colleague or the other person. Medical errors and patient safety, so I can't emphasise enough how important patient safety is, not just in the SJT exam but on the wards as well. And you'll see that that's a big thing as well, so always make sure that patient is safe. So if an error did occur, the first thing you're meant to do is go and see, is that patient okay? Do ABCD approach, are they still alive? And then rectify the error as soon as possible so that no further harm is done. And then let your senior know. I know this can be sometimes quite difficult. You think, God, he's going to shout at me, but do it, because they'd rather hear from you than have somebody else tell them about your mistake. And then also you need to then document that as an adverse incident. Then just seeking advice, so just you able to seek advice, well, know who you can seek advice from, so you've got your clinical supervisor, other senior doctors, colleagues or your fellow F1s. Then managing time at work, so generally you're meant to work the hours given, you shouldn't really be working any later, but if there are jobs left that you haven't done and nobody else can do them, then you do have to stay late and just complete those jobs. Otherwise, if they're reasonable jobs that you can hand over to the on-call person, then that's fine. So your health, again, I remember some of these questions turning up, so don't try and self-medicate, go and see your GP if you've got any issues. Handover-wise, so direct, so picking up the phone, calling the on-call F1 or whoever, better to call them and speak to them directly rather than sort of handing over messages or leaving post-it notes somewhere in the office. Then the other thing is handover sheets. So this is I've been told off, my firm's been told off for doing this, sort of just leaving them around the hospital, just taking them home, forgetting them on buses. So that's actually really serious, and they do take that really seriously, so don't do that. In fact, you shouldn't really be going home with any patient information. Then, so patient concerns, so go and see that patient, explore their concerns, find out what the problem is before giving any reassurance. And then just don't assume that if you've spoken to the relatives, and it's better to speak to the relatives and the patient so that both of them informed rather than speak to the relatives hoping that they're going to pass on the message. Then just briefly, what a good F1 should be doing. So, like I mentioned, patient safety first, confidentiality is a big one as well. Involve the members of the team. Speak to your seniors if you've got any questions, if you're not sure about anything. Don't sort of make decisions based on, I'm pretty sure this is right, and then go prescribing some drug which you're not totally sure about. But likewise, don't be too confident. Don't sort of take decisions which should be made by your senior. Speak to them, but don't sort of take certain decisions on your own. Address immediate issues first, and then longer term problems. Spoke about that already. Again, call people yourself. Don't sort of hand over messages. And then again, handing over effectively. Right, things you shouldn't really be doing as an F1. So breaking bad news, you're not really expected to do that. Discharging patients. So even if you're tempted, the nurses are bugging you. They really want to go home. Can you do their TTA? You can't really just send them home without having your senior give you the go-ahead for that. Never tell your patient, okay, everything's fine, you're right. Don't give them false information. Consenting for operations or procedures. In general, as an F1, you're not allowed to do that, except for if you can actually do the procedure yourself and can explain all the risks associated with it. Accepting referrals from other teams, so referrals shouldn't be made through the F1, they should go to the SHO, or most often the registrar. Prescribing outside of hospital, so don't prescribe for your family members or friends. You're not allowed to do that as an F1, or really anytime. Again, we mentioned this already, giving away bleeps, handing over bleeps, or neglecting duties. So that can also count for when you have teaching. So often somebody will sort of babysit your bleep when you have a teaching session. And also, I forgot to mention that teaching is a really important thing as an F1. So even if you're really, really busy on your job, you are still expected to go to teaching. It's compulsory. And it's really important part of your development. So don't sort of the teaching side of things, even if lectures can be really boring, it is really important. And then again, getting nurses to do your clinical jobs, especially at King's, actually nurses are really, really good, so they often do bloods and cannulas and catheters, so that's great, but don't expect them to do sort of complicated procedures because you feel unconfident or something. And then there's a bad F1 will also just ignore situations or not answer their leaves or not go and assess a patient when the nurse is calling them and they're unwell. And then again, the last point is being overconfident, managing a sick patient without any senior involvement, or you're not informing your senior because you think that you're amazing and you can deal with the situation. Shouldn't really be doing that without letting the senior know. Okay, so then moving on just to a few personal bits of advice for SJT. Now, this is my personal advice. You may totally disagree with what I'm saying, but it's just, I guess, good to get a different point of view on things. So this is mainly what I did for the SJT. There's the GMC's duties of a doctor, which I think we were all given in our first year, and I don't, and then read. But you can get them if you email the GMC. You can get them for free. Now they are pretty boring to read, but I would still just recommend just reading them very briefly, because they are kind of like your Bible for being a doctor. I wouldn't say that they're particularly, I didn't really necessarily find them that useful for the SJT, but it's kind of maybe subconsciously something did sink in, so probably best just to, in the time now when you have to stress, just get that out of the way and you don't have to worry about it. Then also a lot of people think, oh god, SJT is all just a bit of common sense, and that's a bit what I thought. I was like, any sensible person, is just going to know what to do. Yes, to a certain degree, but no, you can actually, you do need to prep for the SJT. There is some preparation that you can do. So don't just think, you've got great common sense. It will help you, but maybe not enough. So like we mentioned earlier, so another thing is just, we said being on the wards is great, and yes, that is the best thing to do, but you'll find that you have so many other things to do in your final year that you just don't really want to be just lingering around wards, hoping for situations to arise, for arguments to kick off on the ward for nurses. So that's what I thought. So my advice would be just to sort of maximise your time on the ward, maybe just speak to your F1s and be like, have there been any situations, has there been any drama, any gossip on the ward, just ask them, there always is. And how do they deal with certain situations, so don't just hang around and be passive, just get involved, ask them about these things. And even like the nursing staff, so get their point of view on things. And the other thing is also just getting familiar with who is in the hospital, like what, the ward clerks, the healthcare assistants, who are all these people, what's the hierarchy, knowing also that there's a clinical advisor, your educational advisor, and what they do, and what their roles are. So just being a bit familiar with all the people around the hospital, because obviously if you're great and you're always on the wards, you will know that, but if you're a bit like me and a bit like, I'm wasting my time here, just make an effort. Then the other thing is, like I said, practice questions. There's loads of resources out there. I think Nick was going to talk about them a bit more as well. And some of them are crap, some of them are good. So everybody has, just find what's good for you and what you enjoy. The other thing is, you might disagree with a lot of the answers, but don't get frustrated. Just use it as a practice and don't get bogged down if you disagree with with the ranking of one of the questions. I particularly found the Oxford situational judgment test useful. There's also like practice. There's practice. So I think they break down the different areas, the different themes, and then they've got loads of questions in those. And then at the end they've got, I think, 2 exams which you could just do, and then you can time this out as well. And that's for free as well. You can get that through the King's Library for free. Then there's also, I did the official practical exam last, and that was really good. But definitely if you're going to do it, time yourself. Then in Red, I've got definitely, I don't think you should be spending any money on SJT courses. I personally think you should save your money. There's plenty of other more useful courses out there, especially when you start doing F1 and all this. It gets quite expensive, so save your money for those things, I'd say. Group discussions, some people find it really useful. Personally, again, I was just like, I'm not going to start arguing day and night about an answer. So some people find it really useful and to talk over things, and yes, it could be, but I don't like arguing. I'm quite strong-headed, so I don't want to have it my way. So anyway, yeah. Okay, so then do an exam. So get in a good framework. Think about, what should you be doing, not what would you do? Again, thinking of that friend who's just perfect, who would always do the right thing, so the nicest thing would be perfect and nice. Don't overthink it, there's no time for that. Read questions thoroughly, so in detail. Sometimes you'll find that there's not enough context or not enough details, so don't sort of over-interpret a scenario and think, if this was the case, I would rank it this way, or if that was the case, I'd rank it that way. Just use the information that's given to you. Okay, don't sort of over-interpret the situation. Then between the two things, I found the pick 3 one easier, because it's a bit like MCQ exams. You can sort of cross things out by exclusion, and then that sort of helps a bit. With the ranking bit, that is a bit harder, and my advice, as Penny said, sort of pick, rank number 1 and then number 5, and then what's in between, sort of like just do something. You'll still get most of the marks for it if you still rank 1 and 5, so that's alright. Then just make sure that you keep track of time, and my most important point, I want you to all not forget this, is finish the exam. I have a few friends who didn't, and who are amazing, and have ended up in really horrible places. So, don't not finish the exam. You've been idiots not to finish it, okay? Alright, I think that's it for me now.
Alright, so just got a couple of minutes left, so I'm just going to look through different things, and as you can tell from what everyone said, different things work for different people. So I think the good thing is now you've got a couple of months, try the different options that are available that we're going to go through and see what works for you. Okay, and different things that we're going to just briefly go through and touch on again. There are the official questions on the website, and then there are the resources to read, like the GMC books and things like that. There are the question books that you can buy, the unofficial ones. There are courses and teaching lectures you can go to, and some cost money and some don't. And then there's small group sessions, which I'll touch on again in a second. Okay, so firstly, it's the official questions, which I think unanimously everyone here agreed that they're probably the most useful things out there. And I think that's because they're written by the people who are writing your exam. So again, they're written from that perspective, from the perspective that you want to get into, from the mindset that you want to be in. And the only downside is there aren't that many of them. My advice would be to not really worry about the answers, like Zilla was going through. Try and pick out the key points, try and think like the examiner, try and see that question from the eyes of the person who's written that question. Take your time to begin with. So I mean, whereas Teresa found it more useful to leave it till the very end, another way of doing it would be to go through it quite early on and try and see if you can get into that sort of mindset. Here's one of the questions here that we won't spend too much time on, but if you read through that, what I would do rather than trying to go at it and try and get it done in 2 minutes is try and pick out the key words there. So for me, I'd be thinking, looking at the good core duties that you want to have as an F1. Patient safety is up there, and that's sort of brought out in those sort of points where they're showing the patient being unwell. And there's issues about handover, which we've touched on, and which are important as an F1 to get right, and also work-life balance. So if you pick out these things and say, this is what the examiner is trying to drill home, that's one way of really using and maximising your yield from the questions that you're doing. And again, then if you look at the answers, which are also available online, you'll see that what they've written matches up with what you would have put down if you're going the right way. And then that sort of match is sort of more useful than if you match the correct answers, because it shows that you're thinking in the same way as the person who set your exam, so you're going to do well. The next thing is these resources. Again, they are quite dryly written, and they're not very interesting to sort of sit down and read. What I would say the best way to use this would be, again, pick out the points, pick out the key points, pick out good clinical care, teaching and training and sort of think about what sort of questions can be written about this. Like Teresa said, it's sort of like a Bible. It's sort of like the keywords are in this book, so they're the keywords that you need to draw out from these books and think, how would a question be written about this, rather than trying to read through it and try and memorize the facts in it, because that's less useful. Question books, there are lots out there, probably a lot more now than there were last year, and there'll be even more next year, because anyone who's done the exam thinks, can have a go at writing a question book and then charging money for it. I think they're obviously useful to an extent, in the sense that it can help you sort of keep familiar with the topics, try and see what other people will be thinking when they're looking at their curriculum and what sort of questions that other people can design. But that's what you've got to realise, is these questions have been designed by trainees, by people who aren't in the official capacity for designing these questions. So again, this is someone's opinion. Another downside that I found was a lot of the options in these sort of practice questions were so black and white, in the sense that, you know, let someone be drunk on the ward. That's common sense from a child would know not to put that as correct. And you won't see anything really like that in your exam. So again, this might have been what lulled me into a false sense of security, that I was fine for time, because going through a question like this, you'll be done within 30 seconds. In your actual exam, they're a lot more detailed. The questions are a lot longer than 2.5 lines, and each answer is a lot more difficult. You need to pick out the points from each one. So again, be wary with those things. Courses, there are lots of them out there. If you find they work for you, go ahead. But again, they can be quite expensive, and again, it's someone else's opinion for what the exam is going to be. So again, take them with a pinch of salt. Small group sessions. Some people it worked, some people it didn't. For me, I think it did work for me, because I think I especially finally, I was quite opinionated, in the sense that I thought, oh, I think this is what should be done, and I didn't really think that there was another really real way around it. When you sit down with people who have got different experiences, different backgrounds, different sort of opinions and things like that, you find that other people do make really valid points, and they're things that you would not have thought of if you sat there going through questions by yourself. So I found sitting with other people, so if you get placed out in a DGH in Worthing, where I was, you've already got a ready-made group of 8 people who can sit down and work together. And go through questions and go through issues and go through key points in the curriculum, go through things that you've seen on the ward. And I think in a way this exam is a lot easier to revise for than a written exam. Rather than sitting by yourself in a library going over facts, this is something you can talk through over dinner, talk through with friends. Obviously not all the time, but it's something which is a lot more relaxed and a lot easier to sort of prepare for, and sort of less taxing and more enjoyable to an extent. The other thing is, doctors can help you with these sort of things. So rather than asking a doctor for teaching on pancreatitis, which, you know, as an F1 or an F2 or even whatever grade, they might not be as familiar as you are, and might dread talking to you and teaching on something that they aren't familiar with. Asking them to tell you about what they do every single day is something which they would much rather do, something they would find a lot easier, and something which could be more useful for you. Like they all said, if you find someone on the ward or someone that you're working with who seems quite helpful, someone that you just want to talk to, something that they've got far more experience than you will be able to gather in the next 2 months. And so simply asking them for half an hour to go through a couple of issues that you come up with, a couple of things that you don't really understand, why decisions are made, ask them what a cross-match is, ask them what a radiologist does. There's something that you can do, and it's a lot easier for them, and it's something that's quite useful for you. Okay, so I think this has been a 1 hour whistle-stop tour of lots of different pieces of advice from 4 different people, and it's something which probably a lot of it has gone over your head. So I would say go back and have a look at this, because a lot of the facts a lot of the opinions that everyone was giving, I found is something that in retrospect I would have found quite useful. So I'd say definitely go over that again. Again, summarising again what we talked, small group sessions, go into clinical placements and learn what's going on, use the online question bank, and most importantly, take it seriously. Although it's a little bit more relaxed, a little bit more enjoyable to prepare for, don't underestimate the importance of the exam and the importance of good preparation for this. So good luck to everyone, and I hope you have a really good year.
So yeah, we've got about 10 minutes for any questions for Nikhil and the other doctors who've kind of given up their evenings to help. We're also handing out some feedback forms at the moment, so if you'd be so kind as to fill them out as a token of your appreciation for the kind of people who gave up their evening. In the meantime, yeah, any questions?
Yeah, feel free to ask anything. Don't do the usual King's thing of just keeping mega quiet until someone else asks the question. No judgment. Yeah, sure.
So when you're ranking your choices for when you were applying last year, were you trying to play a game? Or just like,
By ranking, you mean ranking in the exam or ranking for jobs? F class.
So like when you were ranking your choices, were you like, okay, I want to go to this place, so I'm going to rank that as number one? Were you
Yeah.
very simple? Or
I don't think that's a game. Yeah, I think if you want to go somewhere, rank it as number one. I think you've got to back yourself that you're going to do well in this. You can't approach this exam thinking I'm going to do badly. And honestly, people who have done not so well in their EPM really can turn it around with this SJT and put themselves in a really strong position to end up where they want to go. So again, these 2 months can really be crucial to turning it around and spending time where you want to work. Yeah, so back yourself.
Yeah, can I just add that we're going to have a talk about ranking and FPAS after the break, as well as talks on lots of the other aspects of finance. If we can keep the questions at the moment to the SJT, that might help.
No?
Yes, one up at the balcony?
You just keep that for colours now.
What would you say was the most common mistake that people make with regards to
I can't hear you. Most common mistake. So I think, having spoken to a lot of my colleagues, the thing that people most regret is not finishing the exam. There are girls and guys who I just spoke to someone a couple of days ago and asked them, and it just happened to me, what her biggest mistake was. She really regretted not finishing the exam. She came out crying, and I think even at that time you don't realise how big a mistake it is, because it really can cost you a lot. I think the other thing is read the question very well. So these questions, senior people have deliberated over for long period of time to pick every single word of these questions and answers. And just like your university exams, but I suppose even more importantly here, every word here counts. And every word here, whether it's your team member, whether it's your registrar, whether it's the other team's registrar, whether it's your colleague F1, whether it's your consultant, whether they're hungover, any word like that really changes the perspective and dynamic of each question, which is why it's important to approach it with a fresh perspective.
There's one at the top.
when do you get your scores?
You'll be in your third rotation.
It normally comes out around March. You'll be in your third rotation by then. It's all quite late and you'll be waiting for it for ages. But once you've sat the exam, just forget about it, because by that time you can't do anything. You just need to work towards your academic score. So yes, around March it comes out.